Have you ever gone to an all-you-can-eat buffet and immediately gone over to the dessert table to see what you're about to get yourself into? No? Well, I sure have. Cookies, pies, ice cream, chocolate-covered strawberries, brownies, especially brownies. You list the desserts, and I can almost guarantee that I've tried it and enjoyed it at least once or twice. That exception being pumpkin pie. I'm not the biggest fan of pumpkin pie. While I might feel good actually eating the desserts, around 30 minutes later, 30 minutes to an hour I'd say, kind of feel like garbage. It kind of feels like whenever you first get off the teacups at the fair, after being spun around so many times, you stand up, feel a little dizzy, a little lightheaded, kind of just like the world around you is just whirling all over the place. Could that be because I ate too much or I eat too much? Possibly. I'm kind of a pig when it comes to desserts. I really enjoy them. However, there is one similarity between all of the food/menu items that I listed just a second ago. And that is they're all high in added sugar. So, what is sugar? What is sugar? And how does it affect the human body? It affects the body in numerous ways. Some of those ways being an increased risk of diabetes, dental caries, and cardiovascular disease. According to the National Institute of Health, limiting sugar exposure in utero and during the first 2 years of life could protect against type 2 diabetes, which causes us to question whether or not us as humans are meant to consume a diet that's high in sugar or has high frequency sugar consumption. If it is so detrimental to us in our early stages of life and early stages of development, that we should continue to eat it outside of those development years as well. Not talking about glucose or natural sugars, and specifically talking about added sugars. However, increased added sugar or consumption of added sugar not only could lead to type 2 diabetes, it could also lead to tooth decay as well. As you can see from this picture up here, there's a lot of brown spots on these teeth. Specifically, noticeably, the front two teeth and also the teeth to the side. Those brown spots are what's known as dental cavities. When compared with consumers with low amounts of sugar intake, higher intake consumers have 0.9 more decayed tooth surfaces in their mouth. But what is a dental carie or cavity? A dental carie or cavity starts out whenever plaque and sugar sticks to the outer surface of the teeth called the enamel. That plaque and sugar then metabolizes into an acid that eats away at the surface level of the teeth. That surface, the enamel. Once the enamel is gone, the next layer of the tooth that the infection or disease or caries can spread to is the dentin. And that is most notable because it is the bulk of the tooth. It's what makes up most of it. The enamel is just a thin layer. The tooth is primarily the dentin. Once the dentin's gone, the next stage of the tooth is the root. The root is where all of the blood vessels and all of the the nerves of the tooth are, and the dentin and the enamel kind of acts as a protector. However, once the dentin and the enamel are completely gone, all that's left is the root. Once that infection gets into the root of the tooth, there's nowhere for that infection to go. It has to go out somewhere. So it'll cause an abscess, which is a visible sign of infection in the gums. Once it gets to that point, you're going to have a lot of pain. The patient in question also risks the spread of that infection to not only other teeth in the mouth, but also to vital organs, such as the brain, which could inevitably lead to death. The risk of tooth decay is a major concern for increased amounts of sugar in our diets. However, another risk is that of cardiovascular disease. The risk of cardiovascular disease. In a 15-year study published by JAMA Internal Medicine, people who got 17 to 21% of their daily calories from added sugar had a 38% increase of death from heart disease. Compared to those who consume 8% of their calories as added sugar. The article goes on to state that there is no direct connection that can be found to increased sugar content as well as cardiovascular disease. But there are indirect correlations, those being chronic inflammation and hypertension, which can all lead to heart disease and heart failure. So in conclusion, sugar has many effects on the human body. And from what I've researched, the majority of those effects are detrimental, more so than beneficial to the health of most humans. The ones that I've brought up are just a few of the effects. Those being an increased risk of diabetes, increased risk of cavities, and cardiovascular disease. If there are any questions about the effects of sugar, specifically about how it affects the human body, feel free to ask any questions.